Hello everyone, I'm Dr. Yogesh, Senior Orthopedic Consultant at Aster Whitefield Hospital, Bangalore. Today we are going to talk about the World Osteoporosis Day, which is going to be observed on 20th October. So why this World Osteoporosis Day? To raise the global awareness on osteoporosis. And the theme for this year is it's unacceptable. That is why it's unacceptable, because it is most of the times underdiagnosed and undertreated. So what happens with that? So there is increase in number of fragility fractures in elderly, which becomes a major inconvenience to the patients and even the attendants who are looking after them. As a whole, to the family, it becomes a burden. So it's very important for us to diagnose it at the right time and treat it accordingly. It should not be undertreated. So how do we diagnose it? We have few investigations to be done in elderly. For example, very basic things like calcium, vitamin D, and bone mineral density. And the most accurate thing is DEXA scan. So most of the times we usually get the basic things first. If the vitamin D is very low, then we treat it accordingly. And if the patient complains of severe body pain, muscle pains, and tiredness, these are all the symptoms of osteoporosis. Hair fall, including hair fall, and with very trivial fall, they sustain fractures. So this fragility, we call them fragility fractures. So these are all the symptoms that gives a suspicion of osteoporosis. So first we get a basic investigation like calcium and vitamin D. Next we go to the gold standard investigations, that is DEXA scan. A DEXA scan is nothing but it's a X-ray absorptiometry where the entire body or the 3 points in the body, for example, the hips, the spine, and the wrist, which is the most common areas of osteoporosis occurring first. So that is scanned, and we take the scoring of that called T-scoring. If the T-score is less than -2.5, then we label the patient as osteoporotic and treat them accordingly. So bone mineral density, the investigation where the foot is used to analyze the density of the bone, it is less accurate when it comes to DEXA scan. So always it's better to go with the DEXA scan so that you are sure of what is the degree of osteoporosis and treat it accordingly. So now coming to the treatment part of it. So the treatment, which starts with, again, very basic things like calcium supplements and vitamin D supplements. So it's very necessary that you should not take only vitamin D alone. It's always better for a better outcome, to take it along with calcium supplements. So vitamin D, 60,000 international units every week for 12 weeks, followed by a maintenance dose of 60,000 international units every month. So it's preferably taken after it's a fat soluble vitamin D. So it's always better to take after a fatty food intake. For example, your normal breakfast or milk or any oily food in the morning, simple, not too oily. So anything which is fatty, so after that, if you take it, the absorption is better. So once in a week after breakfast for 12 weeks, followed by once in a month, along with calcium supplements, which is to be taken every day. That's a very basic treatment to start with. If the osteoporosis is very bad, then we go to the next step, something called bisphosphonates. So they control the bone loss. They control the bone turnover. They don't increase the density. Other around, they control the bone loss, and that also has to be taken weekly once, bisphosphonates. The next step is teriparatide. It's a DNA recombinant technology where we use the teriparatide hormone, parathormone, called as teriparatide, and give it to the patient subcutaneously. It's something like an insulin injection. We take it every day for at least 6 months to improve the bone quality. And after that, we have something called denosumab. It's a monoclonal antibody where it is given once in a 6 months for at least 2 years, and depending on the repeat DEXA scan, we can even extend it up to 4 years. So these are the various treatments by how we can treat osteoporosis and prevent fragility fractures in elderly. So never take your medications by yourself. Get it investigated properly by the nearest doctor, and also get it treated by a doctor instead of self-medication. So for any queries regarding osteoporosis or any treatment, you can consult us at the Aster Whitefield Hospital, Bangalore. Thank you.